Health officials are expected to recommend a third vaccine or booster for COVID-19 for all Americans.
And that is raising questions for many people, especially those who are hesitant to get any of the shots. Dina Senefani joins us now live with more. Hey, Dina.
Yes. So how is this going to work? Let's get some answers. We're getting a lot of questions from our viewers, from you at home about this booster shot. We've been talking about it all morning. Right now, Dr. Matthew Sims, Director of Infectious Disease Research for Beaumont Health, joining us live. Dr. Sims, good morning.
Morning, Dina. How are you?
I'm good. So I'm going to throw a bunch of questions at you, and you tell us what you know at this point. And we haven't got the official announcement yet, right? First of all, tell us where we stand on the recommendation.
Sure. So, a few days ago, the FDA approved and the ACIP recommended the booster shot for immunosuppressed people. So people who don't make a normal response to the vaccine, in the hopes that the third dose would give them a better response. And there's some data to support that. Not all immunosuppressed patients, but many will get a boost. But now they're talking about boosters for everybody. And that's based on data that we haven't seen yet. According to the latest that I've heard, this has been formally submitted to the FDA by both Pfizer and Moderna. Their data at 8 or 9 months suggesting that protection may be waning and that a boost will be effective in restoring and perhaps even improving the protection that the vaccine gave after the second dose.
How do we know? So 8 months, there's nothing magical about 8 months. They're just saying, look, when we test people's, antibody levels, we see a dip at the 8-month mark?
So there's, again, I haven't seen the data that they have submitted, but there's a number of different ways this could have been done. They could have just tested levels of antibody against the spike protein, which is what the vaccine generates, or they could have gone even further and looked specifically at neutralizing antibody levels, which is harder to do, but certainly they are capable of doing that. And if the neutralizing antibody levels have dropped off, that's more important, because those are specifically the fraction of the antibodies that knock the virus out. But until I see the actual data, the actual paper, or what was submitted to the FDA, it's hard for me to judge exactly what the FDA is going to be basing the decision on yet.
Is this booster shot, will it be the same dose as one of the other shots?
As far as I know, it will be, though I do know that at least Moderna was looking at a half-strength booster as well, but I don't know what the data there shows. That is the half-strength as good or better, or is it that you need the full dose? It's really, again, dependent on what the data showed. Just like in everything else we've been saying along the way, the key here is to be guided by the science, to be guided by the facts, not by a person's opinion that a third dose will just be better, not the companies who make it saying we want to give people boosters.
Right.
But by looking at the data and finding out whether or not it's useful and necessary.
Doctor, what if I think I've got the antibodies, I don't need the booster? Is there a way to get tested or something before I go and get this booster shot?
Again, there are different tests out there, but most of them do not give you a number, like a value of how much antibody you have. They just give you a yes, you have them, or no, you don't. And even the ones that do give you a number, most of those are not giving you neutralizing antibody. They're just giving you antibody. So unfortunately, we don't necessarily have a test that says this person needs it and this person doesn't.
All right, very good. Dr. Sims, we thank you always for giving us up-to-date information. Again, a scientist, Matthew Sims, Director of Infectious Disease Research for Beaumont Health. Thanks, Doctor. We'll be talking to you soon.
You're welcome. Happy to be here.